Hello everyone. Welcome to another Facebook Live session on the occasion of World Down Syndrome Day. Our expert panelists Dr. Anju Suryapani and Dr. Meghna Phadke will be joining us to share their knowledge and experience in the fields of obstetrics, gynecology, and pediatrics. Dr. Anju Suryapani is a highly experienced obstetrician and gynecologist and advanced surgeon. With over 15 years of experience, she has performed more than 500 plus laparoscopic surgeries and deals with high-risk pregnancies, painless labors, and infertility cases. She is an expert in dealing with all types of infertility patients, including IUI and IVF. And joining her is Dr. Meghna Phadke, a renowned pediatrician in Delhi NCR. With more than 12 years of experience, she has a special interest in pediatrics with a specialty of neonatology, neurology, nephrology, hemato-oncology, and intensive care. She has been associated with various hospitals like Leelavati Hospital and Research Center, Faridabad Hospital, and Paediatrics. Together, these experts will provide valuable insights and information on Down syndrome, its causes, and how it affects individuals and families. So don't miss this opportunity to learn from two of the most knowledgeable and experienced professionals in this field. So, doctors, my first question to you is what is Down syndrome and how does it occur?
Basically, Down syndrome is a genetic disease, and it not affected by the environmental changes or before or after pregnancy mother take. It's a totally genetic disease, and it can happen randomly. Basically, we have 46 chromosome, but in the Down syndrome, there is the extra copy of the chromosome 21, and that's why in these child there is a cell contain the 47 chromosome, and that's why there is the brain and the body changes occurs.
Dr. Meghna, do you want to say something on this?
Pardon me?
Ma'am, do you want to say something? Do you want to share your highlights on what
I
on this
agree
Down
with
syndrome?
ma'am. Yes, I agree with ma'am. It is about the extra chromosomes. Apart from this, there can be translocation or even mosaics Down syndrome. So, in this particular syndrome, why we call it very important to identify, because early intervention can make a huge difference for these children. Overall, the intellectual disability is not that much compared to other genetic syndromes, and they can become semi-independent in life. So hence identifying this particular syndrome is very important. And mosaic downs can have better feature than the 47 trisomy downs.
Okay, so Dr. Anju, my first question to you is what are the chances of women giving birth to a child with Down syndrome?
Pardon?
Uh, my first question to you, ma'am, what are the chances of women giving birth to a child with Down syndrome?
What is the incidence?
Ma'am, chances, ma'am, chances.
Yeah. There is in the India there is the 1:850 women's occur, but when age increases, the incidence of the chromosome is also increases. If we say between 25 to 35 year, at the age of 35 year, 25 year, it is 1:1000. But as the age advances, in the 35 at the age of 35, it is 1:250. So we can say that as the age advances, the chances of Down syndrome is increases.
Uh, Dr. Meghna, what are the common physical and medical features associated with Down syndrome? Ma'am?
Yes. See, the medical conditions are the utmost important in order to have good growth in these children. So, most commonly, we say they are associated with thyroid problems, cardiac diseases, and even hearing loss. They generally tend to have a shorter stature later in life. Apart from this, their immunity is slightly on the lower side, Pneumonias are quite common in these babies. Sometimes the neck is quite unstable in certain babies. So cardiac disease and instability of the neck, these are very two important features in terms of severity. And that's why vaccinations are also very important in these babies. And very few babies, there is also a risk of leukemia. Of course, it's not so common for every down baby, but it is there. So screening in the older age group is slightly important in that point of view. Apart from that, physical features are even seen in the newborn. They are seen even in newborn who is yet to born, like an ultrasound, etc. And once the baby is born, we see there's a typical flat faces, there's a typical eye slant, which is different. They have a little low sit ears, oral structures are slightly different. They do have feeding issues because of that. Sometimes there are very palm features are there, or the clinodactyly, what we call, those kind of features are there. And they try, generally the tongue is slightly on the larger side. They end up sticking it out most of the time, and that is quite a common feature in most of the down babies. Apart from that, this is very identifiable. It's not necessary that every baby will have all the features.
Okay, so Mr. Anju, can Down syndrome be detected during pregnancy? And if so, then how?
Yeah, we can easily detect in the pregnancy. For this, we do the various tests. There, the certain test is available. Uh, Between 12 weeks to 13 weeks, we are doing the level 1 ultrasound, that is known as the NP scan. By dual marker test, we can easily detect. Nowadays, enhanced first trimester fetal screening we are doing. In this, we can easily detect, and these all double marker test and EFTS, enhanced first trimester screening test, we are doing with the blood sample of the woman, and we can easily detect the Down syndrome. And if it is not possible, patient is not in the first trimester, then the 14 to 16 week, we can do the triple marker test, and we can detect in the level 2 TIFA scan, and we can do the quadruple test also. And for the confirmation of the, if the baby female have a history of the Down syndrome in the previous pregnancy, for detection of this test, we also do the NIPT, that is the non-invasive prenatal testing, that is known as a, it is also done with the maternal blood, and it's done between 10 to 20 weeks, but it is costly. So we are doing only when the patient having the history, previous history of the Down syndrome, and there the certain invasive test is also available for detection of the Down syndrome. That is the chorionic villus sampling and amniocentesis. In the chorionic villus sampling, it's done between the 10 to 13 weeks, and in this it is the invasive test, and we take a biopsy from the chorionic villus, and by this tissue we can easily diagnose the Down syndrome. And another test is the amniocentesis, and it is done between the 14 to 20 weeks. In this test, we take a fluid from the back of the fetus, and this fluid is sent for the examination, and we diagnose the Down syndrome. So there are the various tests is available by the ultrasound, by the invasive test, and by the maternal blood. We can easily detect the Down syndrome in the pregnancy.
Okay, Dr. Meghna, what are the cognitive and development challenges that children with Down syndrome face?
Pardon me.
Ma'am, what are the cognitive and development challenges that children with Down syndrome usually face?
Yes, yes, yes. See, first of all, it's very important to understand that their developmental and growth rate, the physical growth and the developmental, the vikas hona, those rates are very different from the normal babies. They will achieve some of the other skills, but at their own speed. And again, it's going to be different with each child. It also depends upon how much environment can be created in the first 5 to 6 years of life. to stimulate the baby for the development. Initially, there is, of course, even sucking, swallowing, some kind of difficulties or feeding difficulties can be present. Cognition is also slightly on the slower side, so they are going to the sitting, achievement of sitting or rolling over or standing, that's going to be little late compared to other children. So obviously their activities are so important to induce them, like simple routine play activities or maybe occupational therapy, etc., so that they can achieve these milestones confidently and they can retain them. Sometimes it happens if the child is not enough stimulated, then they may lose that particular milestone. So these things in Down syndrome. And later on, for example, if they want to learn some art or say some music, so that also can be on the slower side because that will not be normal compared to other children. Same is the case with their routine school life or the school subject. The understanding will take time. So generally, they require initially special schools, and when they are intellectually age appropriate, they can be included in the normal school also. Even if they may have a little higher age group, but eventually they will be on the same level of that particular age. And in that case, if inclusion is done, they feel much better.
Thank you, ma'am. So, uh, Dr. Anju,
Yeah.
if Down syndrome is detected during pregnancy,
Yeah.
then what are the options available for parents?
If Down syndrome detected in the baby, only the termination is available for the mother because these babies are very difficult to. There are so many challenges in the life, and we explain all the consequences, and we do the proper genetic counseling of the patient, and then we examine the patient and do the counseling. And they, if they, I think they are not willing for carry this baby, and we do the termination, go for the termination as early as possible.
Okay, Dr. Meghna, what are the medical conditions that can co-occur with Down syndrome?
Yeah, as I already mentioned, it's heart diseases are very common. Thyroid diseases are very common. They have hearing deficits at times. Even strabismus can be there. Some eye abnormalities can be there. They have difficult oral structures, so that also leads to more of adenoids in these babies or adenoid related issues. Sometimes they can even have sleep apneas. Apart from this, they also have little spinal height, which will be affected little bit on the shorter side. And certain severe complications are also seen associated, like leukemias, but that's not very common with every baby.
Okay, ma'am, one more question to you. How can parents help their children with Down syndrome reaching their full potential?
Yes. Yes, this is a very important aspect that once the child is born, how to go about it. I agree with the ma'am as she said if the genetic counseling and everything is done, then they have an option. But once the baby is born and diagnosed, then first important is the acceptance of the child. And for that, of course, doctors are there, gynecologists are there, genetic counselors are there, pediatricians are there, and that they can lead to semi-independent life is such an important thing for parents to understand. And for that, support groups are there. It's very important that the parents should talk to each other, those who have Down syndrome babies, so that the hope is created. And that hope which is created in the parent's mind gets reflected on the child itself. Apart from that, the early onset interventions of physiotherapy, because they have little less tone on their bodies, we call it hypotonic in the medical language, and occupational therapy. to reach to their developmental milestones effectively, and any kind of medical condition which is associated. For example, if the child is hypothyroid, it will add to the slowness of the original Down syndrome's features. So that will create very difficult for the child, because that child will have exaggerated constipation, more of hypotonia, maybe more sleepiness, etc. So those things should be corrected. Correction of neck instability and the cardiac defect is very important in terms of longevity of life. And even hearing and speech therapy is very important. So often there's going to be initial visits which are frequent, but if they are done properly, maybe at 5 to 6 years of age, the child will have better cognition compared to otherwise if not given such stimulation. Other than this, there are in India also there are many support groups like Down Syndrome Federation of India is there, and even there are certain groups like NGOs like Amrit Foundation, special schools which are there. So speaking and sharing of this experience is of utmost importance. And when we talk about inclusion, as I mentioned earlier also, so that the rest of the population has to be very much aware. And this is the reason we are today here for the Down Syndrome Day, so that the rest of the population who's probably not having Down syndrome babies has to be aware, and they have to help when they see such families.
Okay, so Dr. Anju and Dr. Meghna, how can society create more inclusive environment for individuals with Down syndrome? Dr. Anju, if you want to take first.
Pardon, please.
Ma'am, my question is, how
Yeah.
can society create more inclusive environments for individual with Down syndrome?
Yeah, I think everyone should take care and take antenatal care, and so that we can easily diagnose and as early as possible. First, they can come to us, and for we do the level one ultrasound, and when we do the dual marker test, so as soon as possible we can detect the Down syndrome, and we can do the genetic counseling and go further. So that's why we all, our message to our society is to take a proper genetic counseling and antenatal care, and we can prevent the Down syndrome.
Dr. Meghna, your take on this?
Pardon me.
Your take on this? You want to throw some lights on this?
Throw light on.
On how society can create more inclusive environments for individuals with Down syndrome?
Yes, as I said that we have to collectively help these children, and what society can best do is to give them opportunity for inclusion. This is what I said. If a child, suppose of 10-year-old age, is sitting in a class two, who is otherwise Down syndrome, but now he is mentally able to do class two things, then we should be aware that there is no peer pressure on that child. The other babies can be, spoken to about such conditions. Their parents can talk to them and encourage a positive environment for the Down syndrome baby who's sitting in the class. So inclusion is one thing which society can offer, and it actually does not take any money or anything. It is just the mental makeup. So I think that is the best which society can do.
Okay, Dr. Anju,
Yeah.
how does age impact the risk of having a child with Down syndrome?
Yeah, I have previously also told, as the age increases, the risk of Down syndrome is also increases. At suppose at the age of 25, the risk is 1:1000. So as the age increases, the risk is increases, and at the age of 35, it is 1:250 women. So as the age advances, risk of Down syndrome is also increases.
So my next question to you both is, both, what resources are available for families who have a child with Down syndrome?
I think Dr. Meghna will. tell this one.
Yes, yes. Down Syndrome Federation of India, as I said. Then there are Global Down Syndrome Foundation, which is international foundation. There's NGO like Amrit Foundation of India, and there are many special schools which are present who help these children. They help parents also, so that they see other parents, and the new parent feels quite hopeful about the whole scenario. So this can be done, and now with the technology being advanced, these groups, I mean, these websites can be seen by the concerned parents, and when they put in a programs or any stimulatory exercises, they can participate into it. Apart from that, many times it is also seen that these babies have a particular interest in particular subject. For example, there are many famous personalities with Down syndrome who have achieved quite a lot. So Sujit Desai is a musician. He was on Oprah Winfrey show as well. He's a Down syndrome adult, I would say, not a baby now. But it's such personalities, they always give you a lot of hope. So creating a platform also to perform their own activities or their interests. Like some babies could be interested in paintings. That is very, very important. And these things can be organized, and wherever they're getting organized, the parents can participate into it.
Okay, so the last question to you, Dr. Meghna. How can we promote awareness and acceptance of individuals with Down syndrome in our community?
Awareness about Down syndrome
In our community, ma'am.
in our community. Yes, see, for example, the way we are conducting a session today on a Down syndrome day, that itself is a very good advocacy to talk about it. And this can be done on various platforms. We can also organize a particular group or maintain those families who are there. And we can organize some sessions for these babies which are there. And apart from these Down syndrome babies, I feel more of sessions should be organized for the community which are not having Down syndrome babies, so that they are very welcoming towards them, and these children get positive environment, because that's what matters. They should not be bullying or any other things happening in them. They should be hopeful that they can become someone, and when they grow old they'll be able to earn maybe a little bit or have some independence about themselves. That confidence is very important. And when that happens, because when the child is growing, say at around 10 years, it's okay. Parents are also having an age group where they can do certain things. When such babies are 25 or 30-year-old, then the parents' age is also increasing. So for them also, it's very important that the child becomes at least semi-independent. Child finds his own interest to pursue for.
Okay, any take home message from Dr. Anju?
My take home message is every woman should go through the proper antenatal checkup so we can early diagnose the Down syndrome and do further. So I think nowadays that certain there are many diagnostic facilities available, and we can diagnose as early as possible in the 10 week in the Down syndrome babies. So I think with proper counseling and proper antenatal care and genetic counseling, we can prevent the Down syndrome babies to born.
And from you, Dr. Meghna?
Yes, I agree with ma'am certainly, because if we are good at our antenatal awareness, then I think most of the things can be prevented. But yes, if the baby is already born, yes, I would say that be hopeful and spread that hopefulness to everyone. That's it.
Okay, so we would like to express our heartful gratitude to everyone who has joined in this live session. We are grateful to our esteemed speakers, Dr. Anju Suryapani and Dr. Meghna Phadke, for sharing their valuable insights and expertise with us. We also extend our thanks to all the viewers who has joined us live and contributed to the lively discussion. Your presence and active participation made this event a great success. At Metro Group of Hospital, we are committed to promoting awareness and education about Down syndrome and other important healthcare issues. We look forward to continuing our efforts towards creating a healthier and more informed community. Once again, thank you all for your support and participation in event. That concludes today's session. Have a great day.